Okay.
Awesome.
I
That was
think
that
set
was
up.
possible. Yes. Now make me host to like go live. There we go.
Vaccine coverage.
Coverage. Yeah.
Exciting conversation around the communities. And start.
Daniel, also remember to record the.
Yes, on the cloud. Okay, we're going live in 3, 2, 1.
Who's gonna say welcome?
It's just it's not a welcome. It's you know, people coming into the room slowly as Hello everyone, welcome our Kililogue. We'll start in 5 minutes.
Chunga mapenzi yetu kwa simu tutaongea. Mapenzi ya simu sitaweza. Kama unipendi uniambie. Mimi bado ni mrembo sitangoja. Nikapenda naolewa amie. Mapenzi haichagui kabila. Siku hizi mzungu China huoana. Japanizi Mwafrika vile vile. Mie Marina. Mapenzi ya simu saweza. Kama unipendi uniambie. Mimi bado ni mrembo sitangoja. Nikiwa naolewa amie. Mapenzi haichagui kabila. Siku hizi mzungu China huoana. Japanizi Mwafrika vile vile. Mie Marina.
Hello, everyone. Good evening and welcome to Kililogue Series 5, brought to you by Kilimani Project Foundation. My name is Wamoyo Ndegwa, Programs Coordinator at Kilimani Project Foundation. I'm sitting in today for Wanjiro Kaniha, Executive Director, who could not make it to join us today. Kilimani Project Foundation is a local neighborhood association for people who live, work, or play in Kilimani. We were formed in 2012 by a group of residents and have since grown to a membership of over 600 individuals and corporates. It is our vision to create a safe, clean, and cohesive community led by active, engaged, and invested citizens, inspiring other communities. I want to acknowledge our board members, led by our chairperson, Irungu Hilton, Emma Miloyo, Mugo Karanja, Carol Lukalo, Becky Karanja, Pauline Dirango, Daniel Ratemo, and Emily Mutua. Our work is driven by 4 pillars: plan development, environment, social cohesion, and public safety. All our activities are powered by the community through various working committees led by our members. We want to invite those who are on the call who are not our members yet to join us and shape our neighborhood to the Kilimani we want. A bit of housekeeping today. I want to invite everyone to have their cameras on. We have missed everyone, so please, if you're able to, turn on your videos so that we can see each other and say hello to each other. Also, at an appropriate time, we will invite you to give your questions and comments through Mentimeter in the chat or raising your hands to be called in. So until then, please keep your microphones muted. Our host will allow you to give your comments or your questions or take your questions at an appropriate time. We're also running this live on Facebook, where questions will be picked from. So if your members or your neighbors or your family members are not able to join us today, please invite them to view this session from Facebook. Our page is Kilimani Project Foundation. We currently running the session live. Also, onto today's agenda. Our Kililogue today, like many others we have held before since 2012, come from a place of we are a caring community. All the topics we have discussed in the past are matters close to the community's heart. The conversation today is not about chemistry, but on equity access, on how we as a community can raise up to ensure that everyone in the community is vaccinated, especially our elders, frontline workers, and informal traders, and other priority groups in the community. At this point, I wish to hand over to our moderators at Nyambura Moroki and Irungu Hilton to take us through the conversation and give us, see at the end of the conversation, how can we as a community come together and make sure that everyone is vaccinated. Thank you, and Nyambura and Irungu, karibuni sana.
Good evening, everyone.
Good evening, everybody, and welcome to this, the first of the 5th series of the Kililogues, and it's just a pleasure to see all of you. It's been a difficult season, but I think where there are adversities, communities always shine brightest. And I think what we want to do is take you through an interesting and very topical conversation this evening. We have a great speaker, Dr. Omar Luga, who is the Public Health Director for the Nairobi Metropolitan Services. We also have some senior citizens who will be joining us. Jenny Geshaga, it's good to see you. And a couple of other people who have made some time to come and be with us. As has been mentioned, our hashtag is #Kililogues. That's Kililogues as in dialogues. And secondly, the other hashtag is Pata Chanjo. I believe I got temporarily muted, but I hope that came across. So we have hashtags. Please follow us on the different platforms and amplify this conversation. It's good to see so many of you here. So I'm going to start by initially just taking us through a quick Mentimeter, and if you can use another device or another browser. In the chat here, I've just circulated a link to the Mentimeter that we're about to do. We'll do a poll just to get a sense of where all of us are in terms of the vaccination process. So on your screen, you should see this question. In a different device or on a different browser, you can go to www.menti.com. That's MENTI, like in the county. You can also use the code 11653319. Again, 11653319. Of course, Mentimeter is completely anonymous. Feel free to speak openly and honestly. And let's go through a couple of questions just to see where the community is at in terms of vaccination. The first question is, how are you planning your vaccination? Are you already vaccinated? Are you waiting for your turn? Are you not waiting for the phasing and going straight ahead to vaccinate? And are you not vaccinating at all? Let's wait and see what people have to offer in terms of comments. Give you a few minutes to get there. Again, the browser URL is www.menti.com, MENTI.com, and the code is 11653319. Let's take a pulse check. And some of you may be asking, who are the priority groups? We're going to discuss that in great detail with Daktari, but it's primarily health workers, police and security officers, people with pre-existing conditions, and people over the age of 58, as well as teachers. Wait a few more minutes, get a sense of the room. And again, feel free to respond truthfully. Of course, no judgments, no conclusions that we will make from this. It's simply just, this is where the community is at the moment. I'll just wait for a few more people to throw their dots. This evening's program is brought to you by Zoom and Menti, none of whom have given us any sponsorship whatsoever. In fact, sadly, we've had to pay subscriptions for both. It's painful, I know. We're actually just powered really by volunteers. Everybody, with the exception of one person on this call this evening, is a volunteer and has rallied to essentially put this together. Okay, a few more minutes and then we'll move to the next question. Have you already vaccinated? Are you not waiting for the priority groups? Are you waiting your turn? Are you not vaccinating? Let's see how we rank internationally. And we do know from the stats that the vaccination process is well underway. Low turnout, but essentially has started. So some of you will have already taken your decision. So we've got 14 responses. I'm going to keep going because we have a lot to discuss this evening and don't want to spend too much time on a platform that hasn't sponsored us. I hope Menti is listening. 14 responses, 6 have already vaccinated. 2 are not waiting for the priority groups and are proceeding to vaccinate. 6 are waiting for their turn, and no one is not vaccinating. Let's turn to the next question. So stay on your devices or your browsers, and let's see what is the status of the senior citizens in your family. Now, senior citizen by the laws of Kenya is 60 and above, but for the purposes of the vaccine, if you are 58 and above, you are a priority group. And therefore, let's see whether we have where we are at as a community. Have we vaccinated all the senior citizens in our family? Have we partially vaccinated them, or have none of them been vaccinated yet? Let's have a quick poll on this. And don't worry, Okay, just checking again. We've had a bit of a fluctuation here. So keep voting. Sorry, we have too many apps on apparently according to this. Okay, great. So I believe you can, sorry, 1 second. Here we go. So we have 14 respondents again, and we have 3 respondents have 100% vaccination, and 10 respondents have partially vaccinated their senior citizens, with 1 person indicating, 2 people indicating that they've not yet vaccinated any of their senior citizens. So this is the feedback from this. So I would like to very warmly invite now Nyambura to have a conversation with a couple of people who are here and take us into the next part of the evenings. Thanks very much.
Thank you, Irungu. Hi, everyone. My name is Nyambura Muroki. I'm a student doctor at the University of Nairobi and a proud Kilimani resident. So I'm going to be having a conversation with a couple of people. Firstly will be Miss Jenny Geshaga. Daniel, could you please unmute her? The stats are looking quite good. We might be preaching to the choir tonight. Looks like everyone here is there's a level of responsibility, which is really great to see. Okay, Jenny, waiting to get her unmuted. Okay, hi Jenny. No, not yet.
Oh. Hi.
Hello, how are you?
Hi.
Yes.
I'm good, thank you.
Yes, we can. You're looking great tonight.
Thank you.
Okay, so Jenny, you've lived through a longer life than many of us on this call have. And we just wanted to know from you, what has this last year been like? Have you been through any experience of this magnitude in terms of living through a health crisis? And what are some of the things you've missed most? Yeah, just walk us through what this last year for you has been like.
Oh, and what did you say? Have I missed? What have I missed most?
Yeah.
My family is what I have missed most.
Yeah.
Because I don't live with my children or grandchildren.
Mm-hmm.
I actually live alone, and I've not been able to see them physically because I just see them on, like we are seeing each other now.
Yeah.
It's just that physical contact with the, with the family and friends.
Yeah. So you felt isolated. You've had to isolate from your family, from the people you love most, right?
Yes.
Okay.
But, it is what it is.
That's true.
Yeah.
Okay. So you are among the first people in our community to be vaccinated. Can you tell us your experience being vaccinated? Where did you go? When and why? What was the motivation for you to get inoculated with a COVID vaccine?
First of all, I couldn't wait for the vaccine to come. I was very anxious to be vaccinated because everything on the, when they say those people who are vulnerable, people with 50 plus or 60 plus, 70 plus, and people with other conditions, I am there. People with cancer, I'm there. I mean, so when I knew that but there was a vaccine coming, there was no choice for me. I just was waiting as to when it was coming. And when I knew it was around, I was looking. I was busy looking on social media, anywhere that I could find where was this vaccine. So eventually I found that I could get a vaccination in the Gertrude Hospital, booked, and went and had my vaccination. When was it? On the 17th or the week after, thereabouts. Not last week, the week before then. Yeah.
Okay. Thank you. So and in terms of the experience of just the actual getting vaccinated, was the process straightforward? How did you book for it and then go to the facility, or did you just present yourself at the facility?
I just booked through the hospital, Gertrude's Hospital. I booked online, and first I had gone to somebody had told me that it was available there, so I had gone onto their website to find out. So that's how I found out.
Okay.
Yeah.
Okay. And how are you feeling
then
now?
I'm feeling good. Yeah, just feeling very well. I mean, I didn't have any symptoms. I mean, any bad feelings after the vaccine.
Okay.
People were saying, the extreme, being in Christian circles, people were saying you'd be turned into a zombie, all kinds of things, But I'm happy I'm here and I'm not a zombie. Yeah.
Okay. So I think some of your anxieties from before have sort of been soothed after getting the vaccine, because you said you were anxious to get it. Yeah.
Yes. Now I'm very much okay. I'm waiting for the next vaccine, the next jab. I was told I'd be called, and that I was told to be ready around the 18th of May. So I can't wait for that day to come. And yeah.
Okay.
If I turn into a zombie, there'll be many zombies. I mean, all the Clemenians, I want them to be zombies together.
All right, Jenny. Finally, what would you tell everyone else who is listening now and who will listen later about getting vaccinated, having gone through the experience?
I mean, there is, people my age have really no choice. You don't have to even think about it. If you love your life like I do, because I love my life, I love my family, I love my friends, and I want to be there for them, and I don't want to, I definitely I don't want to die through COVID or through anything like that. And God has been good to me. I'm a cancer survivor. I had lung cancer. I was diagnosed with lung cancer in 2019. And if I pulled through that and now I'm cancer free, I'm not going to let myself loose and get something silly like COVID and die. So anybody listening, I mean, just get the next jab, wherever you can. Approved jab, because I hear there are some Nigerians with fake stuff, just go to the right place and get vaccinated for yourself, for your friends, for your family. Because surely people my age are rare. We are now getting less and less. And I'm sure you guys want to have us around. That's what I would say.
Certainly nice to have you around, Jenny. Thank you so much, and definitely not as zombies. Thank you so much. It's been so great to hear from you. You're really a champion of our community, and thank you you've spoken to the fact that vaccinating is not just for yourself, but it's for your family and for the people that you love. So thank you for doing the right thing.
Thank you.
Thank you. So now we will hear from Emily Mutua, who is a member of the board. I see she's already unmuted. Maybe she could be brought on the screen. Hi, Emily.
Hi, how are you, Nyambura?
Very well, thank you. It's great to see you today.
Nice to see you.
We just want to start by passing our sincere condolences to you and your family. We know you lost your mom recently.
Thank you.
Yeah, pole sana. So we just wanted to share what your experience has been like being a caregiver over an elderly person with COVID over the recent, the last few weeks.
Okay, so thank you very much. Actually, my sister was a caregiver, but of course I would pass by and visit them and see how they were doing. But I was also a caregiver for my son. So in my family, my mom, myself, my sister, and my son have actually been infected with COVID. My son was November last year. He's 21, so he wasn't really hit hard. He just had flu-like symptoms, and we knew one of his friends tested positive for COVID. So I sent him for the test, and he came back positive. And then my mom, we went for a funeral. It's very sad that she was just 2 weeks away from the vaccine. May her soul rest in peace. So 2 weeks later, when she passed on, is when the vaccine came to being. And for her, she actually totally self-isolated in her farm in Machakos since March last year. I hadn't seen mom since March last year till she came to Nairobi to attend her sister's funeral. And sadly, after the funeral, she got sick a week later. So being a caregiver it's a tough thing because first you have to isolate. So you're taking care of a sick person, but you're isolating from each other. So mentally, it's a really hard thing, especially when I took care of my son. He's only 21. Can imagine locking down a 21-year-old in a room. So saying, luckily he has his laptop and he had Wi-Fi. So I think he was happy having unlimited Wi-Fi 24/7, but still being sick and lying in bed the whole day. So the hardest thing is putting our food on a stool, leaving it there, getting the person to eat their food. They put it back on the stool, or they call you on phone. They tell you I'm done. They put their dishes back on the stool, and then you have to go and disinfect and wash them and everything. In the process, you also have a house help living with you. So the house help is also at risk. So the struggle is who's going to take care of this person. You know what I mean? Between you and the house help, we were just the three of us in the house. So luckily I had a strong enough house help who was willing to help take care of the boy when he was sick, the young man. So the hardest thing is actually that not having physical contact. When somebody tells you they are okay and they're on the other side of the door, they're on the other side of the wall, and there's no way you can see them to know they are okay, or they just peep through the door. It's very hard for both the sick person and also the caregiver. So it's never, as a mom, how do you pass food? It's like passing food under the door and it comes back under the door and the clothes and everything. And you're sick and your room has to be cleaned. And then you have to decide, does somebody get into the room and clean it, or do you clean it yourself? Are you well enough? So those are the things that actually get into your mental state, and you start wondering, how is this doable? And of course you pray daily for it. For mom, it was hard because she was 85 this last year. And she's been a strong woman. She's taken care of herself. She comes to Nairobi, she goes for a funeral, she gets sick. And you just see her lying there, and you don't know that she's lying there in pain, because COVID sometimes when you sleep, it's actually at work. So it might be eating her some more, and then you get to the point of calling an ambulance to take her. I don't think right now I'm happy seeing NMS ambulances all over the place. I don't think I'll ever forget her being moved and everything. So it was hard, especially for my sister who was with her 24/7. I would visit, I would talk to her, yet I knew I was positive also. So you can imagine there are 3 positive people taking care of each other. So my work was to go drop them the things they need for the week or for the day or what they've asked for, stand at the door very far, talk to her, are you okay? Talk to my sister from a distance and take off. So that was very hard for us, knowing that you can't be in the same room, 3 of you are infected, you're fearing cross-infection. And then coming back home also for myself, because when I had to leave, I had to tell everybody, lock yourselves up, lock the doors, everything, stay away from me, let me leave. It's like you're sneaking out of your house and sneaking back in. So it wasn't easy also going through that. And then the call you get of, we've rushed her to hospital, this is what's happening. And just the journey of calling. So what happened with my mom and my sister, they were admitted in the same room. Because we said they both needed admission, and we said, we can't let mom go into hospital alone where nobody's taking care of her. So you can imagine also calling a sick person to tell you about a sick person. It wasn't the best of situations, but that is the best we could do for mom. Just make sure that there's one of us watching over her. And then also just the process of calling every day. Okay, how are you? How are you feeling? That's me calling my sister. And then after that, I ask her, how's your mom? So she had a burden of being sick, taking care of a sickly person. So it was just a very bad 1 week that we had with them in hospital, to the point where she passed away, and knowing your 2 sisters are in hospital with her and they can't do anything. There's a feeling of helplessness that comes with the whole process. You can't take somebody's soup, you can't go sit with them, the only thing is tell them from afar, I'm praying for you. So I think the biggest hit for COVID is not even whether the person is in hospital. So the person in hospital is suffering mental trauma, being isolated. You're suffering mental trauma, not being able to visit. The doctors, of course, will give you information when they want to give you information. So you can't call every 2 minutes and ask them what's going on. Is she still breathing? Is she on oxygen? What are her oxygen levels? You have to wait till the doctors are ready to give you information. So I think for me, the biggest hit was just the mental status of it, just knowing you can't call, this person is not your normal person with a broken leg or anything, and there's nothing you can do. The hopelessness, the helplessness, it's oxygen, you're waiting for the oxygen numbers to go up. You don't know what will make them go up. You don't know what other symptoms will go up. And then you hear they suffered a cardiac arrest and they passed away. So it's just mentally, it was very difficult. And then also post the COVID bit of you're sick, your mother is sick, she's passed away. Again, organizing a funeral in 72 hours is also crazy. It's actually not 72, it's 48 from the day you're told. By the time you do the obituaries and everything, so it just takes a lot away from you mentally. You have to function. I was sick, I had to function. My sister was sick, I had to function. We had to function, run a funeral within 72 hours. And then because you're also a COVID patient, you can't go for the funeral. So there's so much to deal with mentally. So your mom is being buried and you can't be there. You can't be there for her. You can't be there with your siblings. You can't be there. Family, you're told 100 people. Coming from a big family, you also wonder which people, because there's friends, there's community, there's church and everything. So for me, I think the biggest trauma, despite being hit and being sick, a sickness you can't explain, is just the mental anguish that you're going through. There's a lot of mental anguish you're going through. And if I could ask the government or anybody out there working on the mental side of things, I think it's something that we have to deal with. That will be the next pandemic after COVID, mental issues. Because you won't believe, meeting somebody 2 years from now, you first tell them sorry for the loss of so-and-so, or where do you start that conversation? Is 2 years later. So for me, I'm asking myself, how will I meet somebody who lost a brother or a sister next year, and do I remind them again or don't I? You know what I mean? And then today a friend of mine sent me a message and told me, Emily, I just could not come. I couldn't, I'm sorry. And I told them, it's okay, I knew you were praying for me. So you can see even the affected through us are also going through their own mental anguish because they don't know how to deal with this. You're in isolation. I can't say, Pole, I can't come, I can't do anything. The most they can do is send you an SMS and call you. So what I would say is mentally, we need to do that. We need to take care of
Emily, let me just ask a question. If knowing all that you know now, if there was one thing that you've learned over the last 1 year that would really make a difference for people on this call, what would that one thing be?
The one thing I would say is listen to your body. And why I'll say this, Irungu, is because I tested negative, but my body, everything was saying positive. So if I had not actually gone and seen a doctor and said, just give me medicine to tide me through, whether it's COVID or not, I just need to know I'm safe, then I don't know what would have happened with me. So I think there's the testing, but there's also listening to your body. There's nobody who knows your body as much as you do. There's a state you get to and you know, this is not me. So listening to your body and getting information, Irungu there too. So you listen to your body first. Don't come and ask Emily, how did you feel when you had COVID? Go talk to a medical practitioner. Because it could be symptoms, but you don't know. So listen to your body, go for the test. Even if you get a negative like I did, go see your doctor. The biggest thing in Irungu is see a doctor. There's a lot of self-medicating. So those three, listen to your body, go for a test, go see a doctor.
That's very helpful. You know, yesterday, Robin and I spent a morning at the Kirika Center for the Elderly out in Dagoretti North. And we met a wonderful man called Elijah Mwega, who is on this call now. And we hope that he'll get a chance to speak after Dr. Oluga speaks. But we just wanted to play for you a small little broadcast of a radio program that ran last week as the vaccination rollout started in Dagoretti North. And let me just ask Daniel, if you could just play that broadcast for us. It's just about 2 minutes or so, but it's very interesting. And it really touches on the issue of how are we prepared to protect and dignify our senior citizens right now.
Baada ya serikali kutangaza umma kufika kwenye vituo husika ili kupokea chanjo ya corona, hali hii inazidi kuwa ngumu, kwani kituo cha DC hapa Dagoretti, mojawapo ya vituo vilivyopendekezwa kupeana chanjo hiyo, kimerekodi idadi ya juu zaidi, huku watu wengi wakijitokeza kupata chanjo hiyo. Kinaya ni kuwa zaidi ya siku 3 ambazo wamefika eneo hilo ili kupokea chanjo hiyo, hakuna chanjo wale wahudumu wa afya waliofika ili kushughulikia zoezi hilo.
Kwanza jina langu ni mimi naitwa Ivanson Kuria na mimi ni mkaaji wa Udhiru. Mimi ndiye chairman wa nyumba 10 huko. Tulipigiwa simu tukaambiwa wale watu wote wazee waweze kuletwa hapa kutoka siku ya Jumatatu. Walikuja tukapata watu wako wengi sana na serikali inasema sisi tunakataa. Sisi hatujakataa. Diposa ndio nakwambia siku kama ya leo tulikuwa watu zaidi ya watu 200 na wote tumeenda nyumbani.
Mimi naitwa Mary Wanjiko Kario. Kuja hapa jana. Kuja hapa kama sasa nimekuja hapa hata sijakunywa chai. Nimekuja tu nikiwa mkogwe nidungo ile sindano. Nienda kule naenda. Lakini wajue walitufungia tusitoke hata mtu kwenda ule unaenda kufuria nguo na kuambia anaogopa corona.
Joseph Ombe wa Kiberenge. Nilifika pale kwa DC jana saa 3:30. Tunauliza sasa daktari wataingia saa ngapi? Achuliona mtakujulisha. Sasa jana tulirudi nyumbani kama tunanungunika.
Kulingana na wazee hao, hamna yeyote anayejitokeza ili kuwapa usaidizi. Juhudi zao za kuwafikia wahusika zilizidi kukosa kuzaa matunda, huku wengi wakionekana kukata tamaa. Juhudi za kuwafikia wanahusika na chanjo hiyo pia zilizidi kugonga mwamba. Safari yangu ilinifikisha kwenye kituo cha kuwalinda wazee cha Karika, ambapo nakutana na wazee wenye ghadhabu wanaodai kuwa safari zao za kufika kituo cha DC ili kupokea chanjo hiyo zimekuwa zikigonga mwamba kila uchao.
Tusiwe tunakuja hapa, tunakaa, tunaambia tena hakuna shindano. Watu wajue wengi hapa hivi sisi ni wagonjwa. Watu ijue tu wazee si watu wa kukaa pamoja. Kuna wengine wako na sukari, kuna wengine wanataka kukula. Kuna wengine miguu yao inauma. Kwa hivyo watujue sisi tukujaga hapa kukaa.
Tumekaa kule uwanja imejaa watu na kuna watu wanaambia wase kutoka 58 years.
Elijah Mwega, mkurugenzi wa kituo hicho, wanaitaka serikali kuwaletea wazee hao chanjo katika kituo hicho badala ya kupoteza muda mwingi kwenye foleni wakisubiri chanjo hiyo, kwani huenda kufanya hivyo kukachangia msambao wa virusi hivyo.
Ningewaomba tafadhali wajue hapa Karika tuna mpangilio ya wazee na idadi yetu ya wazee imeshidi 1000. Ingekuwa ya maana hizi vaccine ziletwe hapa Karika kwa ajili kwanza hapa Karika tuko na shade, tuko na space kubwa, wazee watangaziwe waletewe dawa hapa.
Nikiripotia Mtaani Radio, mimi ni Anderson Juma.
Thank you very much. And again, really interesting in terms of this. And I'm hoping Elijah will have a chance to just talk about what could be done. So I'm going to, first of all, just to thank the previous 2 speakers, in particular Emily Mutua, for sharing really, which is something that is still quite recent and quite raw in many ways. And again, just to add, our condolences again and our solidarity. It was wonderful to see the community rise up around your family. And it's a time like that when actually family and community matters. And your community pulled out everything, I think, Emily, for your family. I'd like to very warmly welcome Dr. Ouma Oluga, who many people still call him the Secretary General of the Medical Union, but that is in his past. His future is his responsibility and accountability to the people of Nairobi as the Director for Health Services at the Nairobi Metropolitan Services. Karibu Daktari, please switch on your camera and unmute yourself. We are coming to you in a minute. But let me invite actually, we didn't introduce Nyambura properly. Nyambura is actually a student doctor. So she's actually clinically fit to have this conversation, unlike me, who's just socially loudmouth. So I'm going to invite Nyambura to ask the first question to Daktari, and then if I can request everybody else to drop your questions on the chat, or if you'd like, just to raise your hands, that will allow you to be able to get your questions in, and we'll I guess we'll ask your questions. I'll give you a moment to ask your questions after Nyambura is asked. Over to you, Nyambura.
Thank you, Irungu. We're waiting to see Dr. Oluga on our screens. Dr. Oluga. Yeah.
Hi. Hello.
Hello. Hi. How are you?
I'm good. How are you? How are you? My good friend Irungu.
Very well. Welcome. And you have I think, a member of the Kenya Medical and Practitioners Dentists Union moderating today, and she's a slightly younger generation than you, so I think you should be probably straight. We could have some tough questions. Over to you, Nyambura.
Thanks, Dr. Oluga, and thanks, Irungu. So, Dr. Oluga, I hope you're ready. But this conversation is, as Martha said, it's not very much about the chemistry of the vaccines, but we want to know the role that we can play as a community. So even with our medical background, I think that might sort of take a backseat this evening, just as we discuss sort of the social issues around getting vaccinated. And you've heard from two powerful voices in our community. And just before we start on the questions, I'd love to hear your response and your take on some of the serious issues that were shared. Over to you, Dr. Oluga.
Okay, thank you very much, Nyambura, and thank you, the Kilimani community, for this invite. I think this is the second time I'm having the privilege to engage with the community in these important conversations, and particularly so about COVID. So over 1 year ago, slightly a year and 1 month ago, we declared our first case of COVID. But from research, I think we stipulate perhaps we had it maybe a month or so back from some postulations from KEMRI research. I think over that last 1 year, there's been a lot of issues, and we have seen the damage that COVID has done to several aspects of our lives, not just the social lives and the family life, but we've also lost, actually, we've lost nearly 2,000 lives, people that we know. So far, in nearly every family in this country, there is someone that you either know that got COVID, or someone that you know that lost a family member, or as in the case where we are talking about it here, like Emily, at least you have families that have had more than one person with COVID and have even ended up losing their loved ones. We continue to condole with these families. We continue to wish them comfort, and also we pray that the loved ones rest in eternal peace. And beyond that, of course, there have been a lot of other issues in the healthcare sector with the COVID, and also in the economy. So many people have lost jobs. So many people have lost income. So many people have had to relocate from other countries. There are a number of Kenyans who are still stuck here because the jobs that they were doing out of the country, especially those who are in Saudi Arabia, Qatar, those who are in the Middle East. I know because for the last 1 year, we've been receiving a lot of deportees at the airport, and I know some of them are members of this community. So the damage has gone far, far, far beyond the health of the people and the health of the nation. It's really affected people psychologically. Children no longer have places to play. Those who enjoy sports and those people who do swimming, you know, it's sad. To an extent, even though we cannot currently link it up, even the issues, the mental issues in the society, you've seen a lot of violence, gender-based violence. We've seen a lot of deaths. This may be related to the effects of the containment measures or effects of COVID in itself. So we are in an unprecedented time in the history of humanity, where trade is affected, but also livelihoods are affected, and then lives are affected. And we have had the unique opportunity to live during this time, where we also are expected to learn and give remedies as we learn. And so part of the experiences that Jenny and Emily have shared becomes part and parcel of the human experiences of these times. They are very sad. And what we can do first and foremost as a community, I think Nyambura does, is to give support. There is no better support than community support. We've learned this, and you will allow me to be jumbled up a bit. From the beginning of the COVID response, the first place that was locked down was Eastleigh. And as you know, Eastleigh is a place where there are mainly people of the Somali origin, and also in Nairobi here, it's also the place where we have a lot of immigrant population from Tanzania and also from Somali. And it was easily seen by that community that they were being targeted by government. Also, you've seen from previously also there were, you know, suspicion of, you know, these issues of terrorism, if I were to say it like that. And therefore, even though from an NMS or a government perspective, we were just looking at a COVID response, and because the cases at Eastleigh, that was in April, May of last year, were so much, and there were these containment measures. But on the other side, it was being seen as a target to the community. And so we reversed our approach, and we went and sat with the imams and part of the community. And there's nothing we found that was better than community supporting themselves and the community trying to also look at the guidelines that the government is putting across and saying, within these guidelines, what can we do as a community that is less harmful for us? And that is how we started the issue of community-based isolations in Eastleigh. There were people who were at that particular time contacts, and we needed to take them to quarantine facilities. But the community offered and said, no, we have some other places. We can turn our mosques into places where we can quarantine people. We can feed them so that they don't feel isolated. They don't feel like they're going to the hospital. And this was about 1 year ago. So we've learned a lot of lessons over the years. And basically, to me, the message there and what I can tell you is that the first and foremost is that community support. And I think through your platforms, the Kilimani community has been very vibrant, and it's also to identify people who need that support. This is really what would be of help, because the greatest response strategy in COVID is not whether we can give the medicines or identify the people who are sick or evacuate them or stop them from spreading the disease. the greatest response strategy is to assure them that when they are in that containment, when they are isolating, that someone else is taking care of their family, that their children will feed, and that they are in a safe society, and that they are treated with the dignity that is deserving of every single human being. And I think this is the greatest lesson that we've learned. And so even as we discuss the other response measures, I know that right now the biggest discussion is around the vaccination, but still we have also a lot of discussions around the variants. We also still have a lot of discussions of where can people get COVID. For me, I think that is the thing to learn. And I think Emily already mentioned it, that psychosocial support is very important. And this, from a government perspective, yes, it's important that we still continue to expand what we can do to support families and to support individuals wherever they are in terms of counseling. And we have some hotlines that we use and that we try to reach out. And in Nairobi, we try also to encourage, especially for people who are not very sick, home-based isolation and care. But that comes also with its own challenges that also require a lot of psychosocial support. Now, you will also note that the African society has a lot of other structures of social and psycho support that is not necessarily medical or health related. So there are a number of people where a church is a good outlet. There are a number of people where community conversations such as this one is a good outlet. There are a number of people who they rely on their relatives, they rely on experts in the community. And we think that these ones play a very key role, and that whatever we provide as government, whether we get that a toll-free number that people can call so that they are counseled, so that they are given whatever support, that communities such as yours could actually play that role in a bigger way and link up with our teams so that we are just doing what we call training of trainers, or sort of giving guidance on what sort of parameters such an intervention could be framed on. So these are some of the conversations that we need to have, because Nairobi is a very unique city. And this is also the other challenge about COVID in Nairobi. People in Nairobi are mostly people who have come to work. And unlike the rural setup where the family fabric is still intact, you find people who are living far away from their families in Nairobi, people who are also having a lot of other economic pressures. So when you find something like COVID-19 has hit a family, then beyond the fact that they have to respond, they have to isolate, they have to get treatment, they have to respond to, for example, the death of a loved one and giving a decent burial, they still have other pressures which in Nairobi, which you may not find, for example, in a place like Kakamega or in a place like Isiolo. People still have to pay rent, people still have to get going, and then these are different challenges, and therefore the community can be a very great place to look at these unique challenges and to frame a response based on the same guidelines that we have given for COVID, so that it's not always cast in stone that when the government says this, that the same cannot be implemented without it being curated to fit in the interventions and in the circumstances of the people living in that area. I think I will maybe pause it here first and just open it up so that we can have one or two questions, and before we go into maybe a bit more details on the vaccine discussions. Thank you.
Thank you so much, Dr. Oluga. You've spoken to so many issues. Just the fact that this has been multi-sectors have been affected by COVID, not just public health, but education, gender, urban living and lifestyles, the economy. The effect has been ravaging in many ways. And it's really wonderful to hear that the government response has involved communities, and you speaking to imams in Isli, and just recognizing the power of communities in solving COVID as the pandemic and the social issues that are attached to it. As we segue into the conversation on vaccines, I would like to invite Elijah, who has a question for you, Dr. Oluga. And just invite everyone else who has a question to raise their hands, and we'll get to you as soon as your turn comes. So Elijah, the floor is yours.
Good evening, everyone.
Good evening.
Thank you. My name is Elijah, and I'm a founder of Karika. Karika is an acronym of Kenyan Aged People Require Information, Knowledge and Advancement. We are here in Riruta, Setrite, and I want to first appreciate Kilimani for the invite, and also appreciate Dr. Oruga for participating. It matters a lot to us. In Karika, we are running a daycare center for the older persons, where we have organized groups all over Dagoretti, Dagoretti North and South. And when they come to the center, they do quite a number of activities, one being health-related activities and also income-generating activities. Thank you, Daktari, for informing that the government is also concerned about the community and the approach the community take. Since COVID pandemic in Kenya, I know you have done a lot and you have good plans. I really appreciate the fact that we are concerned as older people who are most vulnerable, and I'm happy because of the colleagues who have spoken there before. But yes, the situation in the society is that there is a lot of fear. There is need for counseling, but also looking at the vaccination. The strategy that the county is doing maybe could be better to use the organized and existing organizations like now Karika, where we have a number of older people coming together. We have at least 1,200 older people registered with us, and they are all coming from Dagoretti North and South. While also in Nairobi, we have other organized groups. I'm happy the display shows what happened in Dagoretti last week. And actually, you can see the queue. These are all older people waiting. And this is after we went to the radio and complained about not accessing the vaccination. One, look at the environment. Very hot sun, people queuing for a long time. And on the other clip, you'll see a very big tent only accommodating the doctor and maybe the client. As NMS, would you mind to provide tents, waiting tents for the older persons? Would you mind to see the time that is taken while waiting for the vaccination? And also, would it be okay for you people from the county if you include us as older people concerned, that when you are planning, we get our people involved in planning so that we can raise the concerns of older persons as equally. Remember, when I talk about older persons, we have two categories. Those are able to do and those who cannot be able to do alone. They require support from the houses.
Elijah, can I just interrupt you a second? Because I think you raised a very important point about how do we get centers like yourselves at the forefront and in the center of the vaccination efforts. That's what I hear from you saying. And it's a great question. I don't want Daktari to lose that question because you could describe a bit too much and then he may not come back to that question. I don't know, Daktari, do you want to come back on that question first? How do we get centers like Kirika Center and of course all the other homes for the elderly at the center of the vaccination program?
Thank you for this. I think for two answers. One is that for us, we would be so much willing to support, especially the centers for elderly persons. And I think when we say elderly persons, we mean people who are living in nyumba ya wazee, as we call it. And I think that one, there would be absolutely no objection. So how they can reach to us is just to do a letter or a note to the Director of Health Services. And then we would prioritize and respond to them immediately. After all, they meet the criteria for prioritization as far as vaccination is concerned. And we would actually organize these vaccinations at the venues where they are, so they would themselves be at the forefront in terms of trying to identify rooms where the vaccinations could be given. Our teams can just assess those rooms for safety. And also we get the correct equipment, and that way then they do not have to have all the elderly persons out in the sun waiting for vaccination. So this is something that that we've done for other institutions, and there would be absolutely no challenge in setting this up. The second thing is that initially there was this news that was coming from the media that there was vaccine hesitancy, and I think that was not really true. It was just about the logistics of organizing and distributing the vaccine, or what we call vaccine deployment. So I think there was a bit of misinformation from the beginning, because the vaccines, when they arrived in the country, then there was the launch, and then initially the prioritization was purely healthcare workers. But as you know, with our logistical chain, in terms of transporting the vaccinations and making it reach the centers, and accountability, and the system that we use for the Chanjo system is one. So the COVID vaccine doesn't have a special system. The government has been giving vaccines for more than 60 years or so. You know, many of you have gotten either the polio or the TB vaccination, or some of you still get the flu shots, and you know, the children vaccinations. So the vaccination setup is the same. So usually the first thing is to train healthcare workers, and then to look at the distribution chain. So apart from the vaccine being safe and effective, the most other important thing is how to store and distribute it in a way that keeps it safe and effective. So that is something that is usually very delicate. So as we still were organizing that, I think the media yes, Irungu, you are saying something, but I can't hear you. I think he's muted.
We go. No, I apologize. I was just conferring with my co-moderator here. Sorry to interrupt you, Luga.
Oh, okay. So the point is that that went out that there was vaccine hesitancy, and then the priority groups, I think it was opened up to even more groups, teachers, frontline, other frontline workers in other sectors other than health. And then the numbers started to swell. So at the time that it was opened up is when also the healthcare workers were coming, is when the teachers were coming. So there was very little time to reorganize the groups for healthcare workers, for other frontline workers, for teachers, and for the elderly persons. And this is what has created what looked like a scrambling, or, you know, very many people in very long lines, which I think as time goes, it has been getting better in a few areas. Although also the way in which the vaccines are released, there is a data system that also has been a challenge. You find, for example, where we have been doing the outreaches, such as in Dagoretti satellite, where Elijah mentioned, you find that they go there, they have tablets, but then they don't have the internet, so they cannot enter the data. So once they register everyone, they have to go enter the data in the night or the following day, and the vaccines cannot be replenished until that data has been entered, because we have to account for each and every dose. So all these vaccines are not yet for sale. There's no single vaccine that is for sale or approved for sale. So that means that the specific batch numbers must be taken back for purposes of also following the individuals who receive them. So I think this is where the challenge has been. So I do not for one think that there was vaccine hesitancy. The University of Nairobi carried out some surveys that were showing that 75% of healthcare workers were ready to receive the vaccine, but did not have an available place to get the vaccine. Because, for example, when we started, it was only Kenyatta National Hospital and Bagathi that were administering the vaccines. Nairobi alone has more than 4,000 clinics. So if you are a doctor with a personal clinic or a nurse running a health center or running a small nursing home in Umoja, closing your facility to go to Kenyatta National Hospital was very difficult. And this was being interpreted to mean vaccine hesitancy, in which in real sense was not vaccine hesitancy.
Let me come back to this issue, Dr. Luga, on data, which I think is a great one. I'm going to ask our technician to put up the stats that were read to us by the Ministry of Health on Thursday, just so that we have a sense of where we've reached. So we know from the Ministry of Health as of Thursday, they have dispatched 800,000 doses to vaccination centers, and about 196,435 people have received their first jabs. And this is, of course, the presumably the AstraZeneca vaccine. Let's go to the next slide. And this is what it looks like a little bit. And I hope the Ministry of Health take up the this infographic that we have here, which is really an equity analysis in terms of who's received it. So we know that 56% of those 196,000 people are male. We know that 38% of them are health workers. We know that 24% of them are now teachers, and 7%, a very small number, a paltry number of 7% are police officers. This figure, which is one of the biggest figures here of others, is not broken down. And I think one of the things we could ask of you as the Director of Health Services is whether this figure could be broken down, as in all the other figures, by age, so that we could get a sense of how many of the people who are at most risk, just on a generational nature, would have been vaccinated. The little poll that we did a few minutes ago suggested that something like only 23% of the people who responded to our poll had done full vaccination of all the people in their family who are over the age of 58. But the bulk of us really have yet to vaccinate all of the senior citizens in our family. So we're still quite far from this process. I wanted to ask a question that Shamla asks on the group, which she says, would it be helpful to start scheduling people based on different age groups? So 58, for example, 58 to 70 and above. And then secondly, wouldn't it be useful to have links where people can essentially schedule themselves so that they know that they're having to wait? One of the things that struck me about the DC's office back in Dagoretti North is that they had people lining up, fortunately with chairs, but again, as Elijah said, no cover from the sun. But they had people lining up with no tickets. So if they only had 200 doses, the 201st person that showed up, who having waited 2 hours to get to the front of the queue, would be told, unfortunately, we don't have any dose for you today, come back tomorrow. And then they would come back and potentially the same thing would happen again and again and again. So isn't it possible, using various databases that we have as a country, to be able to do this a bit more scientifically, rather than this, let's just show up and hope that we will be treated? Back to you, Luga.
Of course, I think that's very useful, and it's true that it's possible to have this kind of scheduling, especially online scheduling. It would work very well for places like Kilimani and Lavington and these other places. Although internet and telephone, phone penetration in Kenya is quite high, so it would work in many places. But having said that, I think what would work more is group stratification. at least from a realistic perspective, I have to say that the systems that have, the IT systems that have been developed for government programs are so, what can I call it? They are so centralized at a very high level. For example, you find the Chanjo system, it's for the whole country. It's not for Nairobi only. So having, for example, access by just ourselves to sort of do our own scheduling would be a bit more difficult or unrealistic at this particular time, unless you have to break it down so that every single region is doing their own thing, which also brings in other issues about vaccine accountability. So this is actually the challenge to be from a very realistic perspective. So even the DHIS is sort of centralized so that you have the same data sets, you have the same server at the Ministry of Health, you have the same people managing it. So this access is not decentralized, and this may be the challenge why it would be not possible to immediately promise that people can schedule themselves online. So what would be most important is to have, as you said, either age groups or the risk groups, for example, healthcare workers or police or teachers, and then have specific places that they can go for the vaccines, or for example, persons with the elderly persons or persons with disability or persons who are having comorbid conditions. And this is actually what we have tried to do. It is easier for us to organize an outreach where we come to vaccinate the elderly persons at the place where they are just an homogeneous group, rather than subject them to other people. It's easier for us to vaccinate healthcare workers in their own place of work where they just a homogeneous group. And I suppose it would be easier also for the police. It would be easier to do that, the same for the teachers, because you find most of these risk groups, frontline workers at the airport, they're just at the airport. So it is easy to organize to vaccinate them at the airport, rather than expect an immigration officer or a pilot to also go and line where there's a healthcare worker or where there's an elderly person. I don't know whether I've responded adequately to the question.
A great response, Oluga. Thank you. Let's go to the next question, Amber.
Yeah, the next question is from Victoria Karedi, who asks when she will get her. She's 44 years old. No, she's under 54, sorry. And she's been told to wait until June when she presented herself at the place, at the point of vaccination. So she asks, how do we get about being vaccinated if we're not on the priority list? And this speaks to 40% of the people on the Mentimeter said they were waiting their turn. So just in principle, a lot of people are waiting for their chance once the priority groups have been vaccinated to get their vaccines. So how do they go about that?
Yeah, I think this is a question that many presidents have had to speak to, especially outside of the country. But for us here, the vaccines are being produced under a mechanism we call the COVAX. So basically, this is a platform that is formed by WHO and an organization called CEPI. CEPI is basically the international version of what we call here EPI or KEPI. We used to call it Kenya Expanded Program for Immunization. And then there is Gavi, which is the global vaccine initiative. So basically the three of them, and especially the WHO platform, what they call the ACT accelerator, especially for the COVID. So under that COVAX mechanism, they are producing vaccines. And because during this COVID, and many of you who are in international relations or diplomacy may know, that medicine or healthcare is now the new war tool, where you saw it with ICU machines, where companies or countries where they could produce ICU machines, they don't easily sell it to other countries. I think you saw many other countries close their exportation of medical equipment, for example. I can give you a good example. For us in Bagati, we ordered for 6 ICU ventilators and we only got 2. And it's basically the same thing that is going on in the whole world as far as some essential medicines related to COVID, related to other diseases also is concerned. So to protect African countries, basically African and South American countries, the WHO negotiated with the companies that are producing the vaccines to protect certain production lines or certain numbers of the vaccines for these populations. Because if we were to compete, for example, with America or with the UK, we wouldn't be able to get the priority as it was with the ventilators and as it has been with everything. So under this COVAX mechanism assures many of these countries that they will also be considered. So that we are getting our vaccines under that mechanism. So we got 1 million doses. And the ministry, of course, has given guidelines on how this is going to be. But we are also getting the second batch in May. And that's why many people, including in America, they're being told, wait your turn. So basically, vaccines are meant to do 3 things. One is to protect you from getting the infection. And 2 is that if you get the infection, it protects you from either getting severe disease or death. And 3 is to protect you from transmitting that disease to the other person. So it is very important that looking at the most affected people, that we start only with that group. And the most affected people, first of all, the people who have been dying most are the people who are above 60. If you look at 60% of everyone who is dying, the age group is above 60. Secondly, is that they are the people who have other diseases. They have diabetes, they have hypertension, they have comorbidities, connective tissue problem. So it is also very important to protect that group. Now, if you look at also the healthcare worker group, so apart from the fact that they are a high-risk group because they see people in hospitals and anyone presenting in hospitals is potentially COVID, the other danger is that they are also the people who are likely to spread the disease to the people who are most vulnerable. So for example, if you're seeing a doctor who has just seen someone who has COVID and you've just come to refill your medicines, for example, for diabetes, that doctor or nurse is likely to also give you COVID. So it is very important that these people, these healthcare workers get vaccinated so that they are protected from transmitting this disease to the most vulnerable people, because anyone presenting themselves in a hospital or a healthcare situation is already vulnerable. And as you know, the elderly people, they have 1 or 2 things that make them go to the hospital. So this is actually the reasons of the justification for choosing these groups. The police, they interact a lot with the people, they interact with the mamambogas, they arrest people every day. So if a policeman is interacting with someone who has COVID, and then the following day they are in another place, they're likely to spread COVID more. So it is also imperative that that group is protected so that they, even though they may be young, they may just be 20 years old or 30 years old, and they are not at risk of severe disease, but they are at risk of spreading the disease to people who have severe disease. So it is important that they are protected. And this is why there's the phrase, wait your turn, not because you are not at risk or you shouldn't be vaccinated, but because of the numbers are few, the numbers of the vaccine doses are few, and we want to have maximum impact from a public health policy intervention.
It's very helpful, Dr. Luke, because I know many of us have been worried about contracting the virus. We all want to be vaccinated. In fact, I don't think there's anybody on this call that is perhaps not willing to be vaccinated. But sometimes we forget there is a science behind the phasing and the priority groups. And it's great that you brought that out. I'm going to just quickly put up on the screen one more Mentimeter for those of you who are able to do this. If you could just on a separate browser, on a separate device, like we did earlier, go to www.menti.com and use the code 11653319. As Nyambura said earlier, the purpose of this call really is to find opportunities for action as a community. So we are interested in understanding, we're interested in greater information and being able to understand all the different aspects of COVID-19 and of course the vaccination program. But ultimately we are committing to ensure that vaccination is a success, that if we don't have 100% vaccination in places in our communities, at least we have 70% vaccination, and that we start with the most prioritized groups. So I'm going to just ask you, if you can, to go to the Mentimeter, just take a minute, and if you could just reflect on what actions, having heard from Majeni, from Emily, from Dr. Luga, from Elijah and Shamala and others, what are some of the actions that we could take as a community? What is it that would generate the 100% vaccination? And I'll keep talking until I see a few ideas that are there. I might even do a dance if you force me to. Let's see. So I can see some comments coming through. And then we'll take the last remaining questions. I think we've got a couple of questions that we'll pick up. Andrew's question. And also I think we've got a question from, I think we've got a very direct question from Emily Mutua, which I think is an excellent one, on the chat. And we'll take one last question, I think, and then response from Dr. Luga, and then we'll come to Emily.
Yeah. So Andrew asks, is it true that the reason we can only have 1 million doses because the cold chain system in the public healthcare system can only handle 1 million doses? Can the government rent or invite people to provide cold storage, like fridges and bars, now that they are closed? Dr. Luga.
Kilimani has a lot of bars and a lot of nightclubs which are closed at the moment, not courtesy of the foundation, but in respect to the curfew.
Yeah, Kilimani has been a difficult area as far as containing bars and
we apologize. Of course, it's none of us that are going into those bars. We have to say, Kilimanians are never seen dead in those nightclubs and those bars that are breaking curfew. It is all the other parts of the city.
And I think, yeah, that suggestion could be explored, but it is not true that that's the reason, because the COVID vaccines, the vials, like one vial is very small and already it contains 10 doses. You can actually even a very small container, a 40-feet container, can even store all the 1 million doses. I think we can store as many as it's about the production and it's about the sharing worldwide. That's why we can only get 1 million. Yeah, but that's why not? One of these days we will not just be having COVID. We can use them to store polio vaccines and these other vaccines. I think we should keep that suggestion open.
I think this and other myths are, there's a lot of different things that people know and believe that are not true. So someone asks on the chat what we can do about the infodemic. And I think you spoke about this, about just shedding light on what's true and what's false. Dr. Luga, so what do you think we can do to mitigate the infodemic?
Of course, is to keep sharing the correct information, but also we have a lot of, and I think maybe Nyambura, you already are aware, we have a lot of what we call anti-vaxxers. So they keep coming up with these videos and very nice explanations on why you shouldn't take a vaccine, and especially on a vaccine that is still what I would call under monitoring, like the COVID vaccine. So far we have around 7 vaccines that have been approved, and then we have another 200 vaccines that are under development, and there are all manner of research that is going on. Most of the vaccines have gotten preliminary approval. And for us here in Kenya, we depend mostly on the WHO mechanism. We also depend on the approvals and protocols developed by the European Medical Agency and also the FDA, the Food and Drug Authority in America, because it's easy to replicate those protocols And so it's easy to replicate those protocols because there are a lot of what we call populations that are similar in terms of genetics to the African population. I think Nyamura understands from a scientific perspective what I'm talking about. So and I know maybe because of the issues of the Sputnik, so that is why you see a lot of politics around the Sputnik 5, because it still doesn't have approval from those organizations, even though it has approval from the Russian authorities. And we have, of course, our Pharmacy and Poisons Board. So they are supposed to also approve either vaccines for research or for sale. And so far, there's no vaccine that's approved for sale. All the vaccines that are approved for emergency, and they're approved under the mechanisms that can be monitored. So the WHO, like for example, the AstraZeneca Oxford vaccine that we have here in Kenya, it's been given more than 300 million doses. So it's very easy to look at the people who got it from the first to now, and we are not the first ones. And so you can look at that whole profile. The Pfizer vaccine has also been given millions, hundreds of millions of times, the Johnson vaccine, the Moderna. So there are 7 vaccines that are generally approved, and then there are a number that are under development. So we encourage the correct information to continuously be shared, but also we encourage that people, people generally just take professional advice seriously. Just like I am not, for example, an engineer or an architect. I would rely on the professional advice of an engineer or an architect when it comes to construction, when it comes to a building, when it comes to a road, when it comes to a machine. Yeah, so I think this is generally the challenge we are having worldwide. It's not just about Kenya, where there are opinion influencers that are not necessarily experts, but then they do not consult experts or do not get expert advice before they share information. Yeah.
Okay, so maybe in closing, and we're going to invite Emily Mutua, who also is a board member of the Kilimani Project Foundation, to do the closing remarks. Maybe just to pick up a couple of questions and bring them together, and then if I can present them to you, Daktari. So there is a very specific request, I think, that has come from Karika Home for the Elderly, that they would like to get in touch with you. Could I request you to put your contacts on the chat so that people who would like to reach out to you, either by email or by phone, can do that. And I'm hoping that Elijah will follow up this call this conversation fairly soon to make sure that he's able to support the vaccination effort, particularly for the elderly across Dagoretti North. I want to link that with Emily Mutua's comment, which is, she says, if the Kilimani community and other communities nationwide, and those of you who are not from Kilimani listening to us today, there is no reason why this could not be done in the different wards across the country. If the communities identify groups that were eligible for the vaccines and helped the groups to do the letters, and also began to identify centers for vaccination, whether it be the churches, the places of the mosques, or the places of worship, or the schools, would that help NMS at this time? Because in a sense, we know the community well. We know those people most at risk. This is something we could do fairly easily. And I think an open challenge to those of us in Kilimani, for example, would be to see whether we are willing to provide some resources in terms of transport to get the elderly who may need it to get to the Kirika Center when they are able to do the vaccinations from there. Let me throw that back to you, Dr. Luga, just to see whether this would be helpful to NMS at a time like this before we turn to Emily and close for the evening.
Thank you very much. I think I have just messaged the number to Elijah, and also I've put email addresses to everyone so that we could continue with the conversation. Yes, but it is true that we can have vaccination if this is organized, so that we get to reach out to the most important groups. We have outreaches, and the Kilimani, I think it falls under the area where we can. Let me sort out this guy. Still okay.
And Luca, just to say that we are so happy you invited us to your home today.
Yes.
We are seeing another side of you that is actually extremely important, and it's very much the side of the community. If that young child would like to wave at us also, we would wave back.
Yes, yes, yes.
We had cats fighting outside. It was a bit like people fighting for vaccination. It was a bit serious.
That's very important. So yeah, so it's something that we can organize. Something that we can organize for the groups and especially for the elderly. But even as Emily had asked about the specific groups of policemen or teachers, because they are in the priority list, that would just be a logistical issue. And we already have our sub-county around Kilimani area that would be willing to respond to such kind of requests.
Thank you very much. Let me last question in the chat. I'm going to ask people who have enjoyed this conversation to just indicate other topics that they might want a future Kililogue to cover. So if you can just throw the topics there, we'll try and work them through. If you have ideas of people you would like to talk to you, there is nobody that is 6 degrees of separation from us. As Kilimanis, we often say slightly arrogantly that we are at the center of the universe, but the proof is whether we'll be able to reach all the people you suggest here. If you're thinking about the Pope, that may be a little bit of a stretch. I would keep it to people who are within this this republic, but yeah, who knows? Give us some topics, give us some resource persons on the chat, and we'll organize that for you. Let me turn to Emily, and maybe we can say goodnight.
Yeah.
Before we turn to Emily. Good night from me, Irungu.
Good night from me, Nyambura. Thank you so much for joining. We hope this was a useful discussion. Goodbye.
Over to you, Emily.
Thank you, Irungu and Nyambura. I think it's an awesome way to end our Easter with information that we've been trying to source from all over the place, and actually just getting information from the horse's mouth is better than anything else ever. So we'd want to give our vote of thanks to all who've joined us today for the first session of our COVID Kililogue. We've had one 5th Kililogue series, and I think this is one of several for COVID. Dr. Luga, thank you for taking your time to join us. We know your days must be on 26 hours instead of 48 of 24, and you have as a young family I can see to take care of. So we are really happy. Jenny Geshaga, thank you very much. You speak on behalf of a lot of our parents, a lot of the elderly, and trust me, if I had COVID and I'm not yet a zombie, nobody's becoming a zombie. I think that's a very good message that you're passing, as it's okay to go and get the jab and you actually heal and come out alive and well without a 4th leg or a third leg. Elijah Karika, thank you very much. I belong to Lavington Rotary Club. We're going to work with KPF. Tina is here. We're going to work with KPF to make sure that the vaccines are delivered. You're a special part of our community. It's hard to find shoshos and gukas in town, and you're those people, and we love you. So thank you very much for joining. KPF board members, again, thank you very much. You're always here for the community, led by our chairman, Irungu, who has so much time for us. We wonder whether he has a day job, but thank you very much, Irungu. Daniel, who's part of the comms team and also a board member, and Mother Wamuyo, who's a programs director, coordinator for KPF. Thank you. Mother is one who opens the session. We're always calling her. She's on our speed dial. She's one who responds to your messages in the evening. And then the volunteers are behind the scenes to make this happen. Having a Zoom call and just putting it live on Facebook and making sure that we don't drop off. This has been led by Annabelle Nyole, Sinke Houghton, Doreen Mataitia, Joy Muroki, Naserian Saruni, Nyambura Muroki, and Robin Emerson. Thank you very much for giving us your time. Also, we want to ask the community, if you're sitting here, you're a member of you live in Kilimani or work in Kilimani, or come and enjoy our good spots, which is the nightclubs, or you have a business here, or your family and friends, please, we're asking you to come and join Kilimani Project Foundation. We take care of the community. We have information that you need. During this 3rd wave, there's been a lot of information that has been going through WhatsApp. So we used to wake each other up at night. There's this place which is giving vaccines, run there now, and stuff like that. Or you'd say, okay, so Hurlingham Women's Hospital was given, but I've been there, they've turned me away, only go if you're 58 and above. So there's a lot that goes on in the community. We share security information, we share information about what's up in Kilimani. Is it a new place? Is it an issue? Is it water? Is it security? Is it electricity? And anything and everything that touches the life of a Kilimanian. We are friends with the police. They are our friends. They're not our enemies. In most places, we fear the security detail. We actually embrace them in Kilimani. So you have more than 20 reasons to join the foundation and be part of a good community. We plant trees apart from being here for each other when there's COVID. We plant trees, we have the street festival. And if you join us, maybe you can also give us ideas of how we can do these things better. And as you can see right now on the screen, we have the community activities which are planned up to August. So for us in Kilimani, COVID or no COVID, we try and make life as normal. We try and normalize things as possible. So we've accepted the new normal, we're embracing it, and we're trying to see what to do with it, yeah? So please join us, even if you're not a member, just come hang out with us, and maybe that is where you'll actually be converted and you become a member of Kilimani Project Foundation. For all the 41 participants, we thank you for being here. We thank you for taking the time off. Tomorrow is a work day. Our new normal demands that we work from home, and we know it's not easy with the kids and everything. So we want to say thank you. You're part of our community and we appreciate you. And please keep coming back. Thank you. And I can see Naomi saying, find ways of building community, build a directory of places where people can safely volunteer time or maybe post-COVID in Kilimani. We've had that, our chairman has had that, and we'll take that into consideration. Thank you and have a good night. I don't know, Irungu, over to you.
No, you've done everything. Thank you very much. Good night and stay safe, everybody.
Bye.
Bye-bye.
Bye.